Good afternoon, ladies and gentlemen. We will actually start today's briefing prior to the briefing itself by joining Canadians across the country in observing a moment of silence to honour the victims of the tragedy in Nova Scotia. The National Police Federation, in partnership with the RCMP, is asking citizens to pause today at this time and observe a moment of silence while wearing red. And so that two-minute moment of silence begins now.
Thank you. Welcome to the City of Toronto COVID-19 media briefing for Friday, April the 24th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto City Manager Chris Murray, who is here to answer any questions you may have. We'll start with Mayor Tory. Mr. Mayor.
Well, good afternoon again, and thank you, Brad. We have now been in the midst of this fight against COVID-19 for almost a full 6 weeks. That is the period of time that has passed since the various measures began to be put in place and life for many, many people, in fact almost everybody across the city, began to change. All those changes were based on public health's advice to protect the health of our city and to save lives. 6 weeks later, your hard work and sacrifices have saved thousands of lives, and we have reason for cautious optimism, something we did not have when this began. In fact, some of the earlier projections that were put in front of me and others by the Medical Officer of Health were really very, very grim until all of you joined this fight. Our goal throughout this emergency is to protect the health of Toronto and save as many lives as we can in the face of a little-known but terribly deadly virus. I also want to thank at this opportune time Prime Minister Justin Trudeau and Premier Doug Ford for working with us throughout this crisis to do just that. Protect health and save lives. Today, the Prime Minister announced another example of the governments working together, and that was the Commercial Rent Relief Plan. I have been advocating for businesses to get help with their rent from the other governments, and I'm glad to see that call has been answered by both the Government of Canada and the Government of Ontario, which worked together to develop this program, which will help so many landlords, and through that will help so many of the tenants who are the shops and the businesses and the restaurants and the bars and other small businesses that need this help. This is a good plan. I believe it will provide real relief, and I hope that many of the businesses that are struggling right now in our city will get that relief, and it will allow them to hang on until such time as better days are upon us. Today, Premier Ford also announced the 5 private long-term care homes that will get support from the Canadian Forces. 3 of those private long-term care residences are here in Toronto, And I want to thank Premier Ford and the Government of Ontario for making this request for assistance, and I want to thank the Canadian Forces and the Government of Canada for making sure that this life-saving help can be provided. I also want to thank each and every person in our city, all of these people doing the right thing, staying home as much as possible, keeping their distance from others when they do go out, and if they do develop symptoms or are diagnosed with COVID-19, self-isolating. I heard Dr. Mitch on News Talk 1010 this morning acknowledge that many residents are bored now, but that's a good thing. It means these measures are working. I would rather be bored than be sick, and I'm sure most of you would rather be bored than be sick. But I recognize that people are also becoming increasingly focused on when life will be able to go back to normal or as close to normal as we're going to get. We've been focused on the health emergency, but also working to protect the economy now and map out a safe, sensible, healthy restart and recovery program. I'm proud to announce today that Saad Rafi will lead the Toronto Office of Recovery and Rebuild. He is already at work developing our post-COVID plan and is working with Dr. David Mowat, who is guiding the health strategy. In these two individuals, I can tell you that we have found the best one-two punch you could possibly find to make sure we have the best plan, the most well-thought-through plan, and the plan that is going to protect health at one and the same time in the best way we possibly could. Over the last 30 years, Mr. Rafi has worked in both the public and the private sectors, including several very senior leadership roles in the Government of Ontario, a government he will be working with very closely in this endeavour. He was the CEO of the Toronto 2015 Pan Am Parapan Games, where he worked extensively with Toronto and the other GTHA municipalities to deliver successfully the largest multi-sport event in Canadian history. You can see the kind of detail that was involved in that will be something very helpful to us as we go about developing and implementing this plan. I am confident that he can and he will get this plan done at wartime speed. And we need that because we need Toronto back up and safely working with good health at the foremost one of our considerations as soon as we possibly can. And this will be no easy task, but it's something that I've asked Mr. Rafi to develop, guided by the public health advice of Dr. Mowat. I'll have more to say about Dr. Mowat in just a moment. Toronto's Office of Recovery and Rebuild will report to our City Manager, Chris Murray, with a mandate of, first, delivering the city's recovery strategies and actions, making sure they are based on evidence, transparency, accountability, and best practices from other jurisdictions. Second, making sure the municipal government itself emerges from the pandemic more efficient, more effective, and more resilient than ever. It is going to be crucially important for us that as we recover and as we renew ourselves, government, city government, not be in the way. Third, working with all governments, with the nonprofit sector and with the private sector to support economic and community growth, including the full implementation of stimulus strategies and priorities and delivering on the city's own continuing priorities. You know, when it comes to this plan and the development of it, and more importantly, the implementation of it, there is no on-off switch. The plan will take a phased approach. We will communicate this plan as widely as we can to residents and businesses as soon as it is ready, so everyone knows the path of our recovery, just as we will have to consult in advance on the details of that path and of that plan. We know the things we know in government, and we know the things we don't know as well as those who will be directly affected by this plan. Throughout this emergency, we have also followed the advice of our public health professionals, including in particular our Medical Officer of Health, Dr. Eileen Davila. And that will very much guide all of our planning work and all of our restart and recovery work. Dr. Mowat, who I mentioned earlier, is a former Chief Medical Officer of Health for the Province of Ontario, who brings to this role more than 30 years of leadership at all three levels of government. He will lead a multidisciplinary team of Toronto public health staff with expertise in epidemiology, policy analysis, public health, and stakeholder relations. This team will review current evidence to inform city officials and to guide recovery decision-making, because everything will be guided by considerations of public health and making sure people stay healthy and that we don't fall back after the success we will have enjoyed by the time we get to implementing this plan. Dr. Mowat, who has worked on emergencies such as SARS, H1N1, influenza, and Ebola, will also provide consultation on when and how the city can reopen local businesses and community facilities. When exactly we restart the city depends on each and every one of us right now. We are very much still waging war against this virus. As Dr. Davila will tell you, and as we hear every day in her update, lives are still at stake, and we cannot take our foot off the gas when it comes to our collective efforts to stop the spread of COVID-19. The efforts that so many of you are making right now, and that you will hopefully continue to make this weekend to stop the spread of COVID-19, will make this great restart happen as soon as possible. At the beginning of the pandemic, I launched a Mayor's Economic Support and Recovery Task Force. And I want to thank a number of my City Council colleagues, including Deputy Mayor Michael Thompson, who heads up the Economic Development Portfolio. All of them have been working on that task force and focusing on individual areas of the Toronto economy. Their ongoing work will be crucial to this overall recovery plan, and I'm very glad we've been consulting extensively and doing a lot of this work to develop recommendations that can be put into the hands of Mr. Raffi and others as they actually flesh out this plan. Any hope of rebuilding Ontario and Canada's economy rests heavily on Toronto's economy successfully restarting and strongly recovering. You might expect me to say that as the Mayor of Toronto, but the facts indicate that I'm simply speaking the truth. Toronto and Toronto's economy are the economic engines of this country. We want to play a proud role in seeing the whole country recover and do as well as it can, and our recovery here is going to be crucial to making that happen. While we're all focused now on fighting COVID-19, it is heartening to know that Mr. Raffi and Dr. Mowat will be doing the important work that needs to be done and that needs to be ready when we come to the closing chapters of this war. As I've said many times, Toronto's success is Ontario's success and Canada's success, and we're proud of the fact that we can play a role, that we've got what it takes here to play a role to make sure it helps everybody in the country to recover from this trauma. I am confident that Toronto, with the help of Mr. Raffi and Dr. Mowat, will meet this challenge. Now, although pedestrian traffic has dropped dramatically across the city, there are hotspots on some sidewalks in some areas. And I've asked through previous encounters with the media that people should let us know where some of those are, and our transportation staff have been doing research in that regard as well. We are working with Toronto Public Health, they've been very much involved in this, and with our Transportation Services Department to identify key hotspots where there are lineups or pinch points on sidewalks that need to be addressed. And we will roll out a plan early next week to address that. In the meantime, I do want to make good on a promise that I made to a Metro Morning listener on CBC this morning who asked that we urge people who are out walking on our sidewalks to be courteous to others. Well, Dr. Davila advises that the risk of catching the virus from someone when momentarily passing them on the sidewalk is essentially non-existent. People still should be mindful of others and remember that we're all anxious right now and that we're all trying very hard to engage in physical distancing. So that means just showing basic courtesy on the sidewalk, stepping to one side to let others pass, or getting the kids and even the dog to walk in more of a single file and not take up the entire sidewalk. This is a time when we have to continue to be good to each other, and I know the vast majority of people are doing that. It's interesting, and I'm sure you've noticed, as I have, that people seem a lot friendlier right now when you do come across them, even if they're complete strangers, and there's a sense that even though we're all asked to keep our distance and not to socialize, that we're all in this together. Our Clean Toronto Together campaign was supposed to be underway. It's really something that tells you we've begun the real part of spring when the weather is much nicer, which is what it's supposed to be at the end of April. But the spring cleanup itself, the formal program that the city runs with many of you as volunteers, was cancelled or at least postponed because of COVID-19. But we still need to do a spring cleanup of the city. And so I'm happy to also announce today that a targeted spring cleanup will take place across Toronto over the next few weeks, starting right away. The city's been working hard to keep public spaces clean and safe, but staff are now out, as they have been for some days now, picking up litter, emptying streets and park waste bins and sweeping streets, and that work will intensify in the coming days. When winter comes to an end, there's always a lot more work to do, things that have been hidden by the snow, and I don't think that we're looking our best these days, and it's something that the staff will begin to deal with in an intensive way, and I hope that we'll be able to postpone and reschedule the volunteer cleanup that so many of you get involved in. The city's annual spring cleanup activities include, and these are the things we'll be getting at in a more intensive way with our wonderful staff starting now, illegal dumping cleanup, boulevard and laneway cleaning, litter and debris removal in parks, fence line litter clearing, and street sweeping in order to clean up dirt and debris from Toronto's streets. And this is often, people have asked me, by the way, why we have the street sweepers out. And one of the answers to that is it clears away the debris that can block the drains. And when the rains come in April and May and on, this can cause flooding. And so we do that for that reason, among others. If there's a particular spot on public property that needs some attention, please call 311 and let us know. And I want to say thank you to our frontline crews who will be out there doing this important work while still respecting physical distancing. There's been an increase in the littering that has been caused by people throwing down items of personal protective equipment, masks and gloves in Toronto's public spaces. This type of littering in particular is very troubling because of the fact that we're short of that. Not that you'd reuse it, but it just seems like something very ill-advised to do, to throw it down on the ground. It's unacceptable. It's a $500 fine if you get caught doing it. This is the littering and fine that applies all the time. But, you know, we don't want to issue tickets. We just want people to stop engaging in that sort of behavior. Be considerate. Use the waste receptacles that are provided at the places where you're using the PPE. I want to say thank you to the residents who've taken it upon themselves to clean up some of this litter when they see it in parking lots and on the street. My office received an email from a man named Graham the other day, and he was out picking up litter while he was walking his dog, and he talks about the fact that he'd heard that the city cleanup day was cancelled, but he couldn't help himself because no one seemed to have told the litter bugs about that. So he said during his morning walk, he started to clean things up himself, and I hope other people will take the initiative on a formal cleanup day or otherwise to do just that. So Graham, thank you for showing that leadership and for emailing me to tell me what you were doing. You know, this is a great city with great residents. It's great in so many respects. The world looks at us and just says how lucky we are to live here. And it's not all good luck. It's been because we've made an effort to make sure that the values that are really at the foundation of how we live and the way that we look after the most vulnerable and so on are just a feature of how we live here. And we're going to get through this pandemic thanks to the strength of the residents, you, thanks to you complying with the things you're advised to do, thanks to those values which see us supporting each other and in particular looking after the most vulnerable in our city. It's something that I come to appreciate every single day that I have the privilege of being the mayor of the city, those values, the way people do support each other, the way they come together to do what has to be done to get through a tough time. I hope everybody has a good weekend. I know that with the weather getting better, it is not easy to stay home, as Dr. Davila will continue to advise us all to do, and to keep our distance from other people when the temptation to start socializing is much greater. But this is exactly what needs to be done in order to conquer COVID-19 and get on with the recovery and rebuild that we're hard at work planning. I look forward with Mr. Murray and with Mr. Raffi and with Dr. Mowat to telling you more about that plan in the days ahead. The day we roll it out partly depends on you. It depends on you a lot, as a matter of fact, and how much you continue to do some of the things that you've been doing that have made such a contribution so far. Let's show this virus a thing or two with self-discipline and self-distancing. That's what it will take to take us to the treasure at the end of the rainbow, which is just getting back to life in this great city. Thank you very much, and it is now my pleasure to introduce Dr. Eileen Davila, our Medical Officer of Health, for her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 9 o'clock this morning, there are 4,486 cases of COVID-19 in Toronto. This includes 4,048 confirmed cases and 438 probable cases. There are 300 people in hospital, 113 of whom are in intensive care units. Sadly, we continue to see COVID-19 deaths in our community, and to date, 238 people have died of this virus in our city. Our thoughts are with those who have lost loved ones and those who are recovering from this virus. I am sincerely looking forward to working with Dr. David Mowat in the new City Recovery and Rebuild role that Mayor Tory just announced. I had the great privilege to work directly with Dr. Mowat for nearly a decade at Peel Public Health. We worked together during significant public health emergencies and responses, including a notable measles outbreak in 2008 and the 2009 H1N1 influenza pandemic. I also had the opportunity to collaborate with Dr. Mowat during the Ebola response in 2014, when he was the Chief Medical Officer of Health for Ontario, and I was the Acting Medical Officer of Health for Peel Region. On a more personal note, Dr. Mowat has been a significant mentor to me over the course of my career. I know from my experiences working with him that his deep public health expertise spans all 3 levels of government. His knowledge and his expertise, combined with exceptional professionalism, are exactly what we need to effectively guide the critical public health work of the Toronto Office of Recovery and Rebuild, and to help us get back to safely enjoying our city. We need to get this right, or we run the risk of prompting another wave of COVID-19. I truly believe that Dr. Mowat is the most qualified person for this role. I do appreciate that as the weather gets warmer, public health and physical distancing measures become increasingly more difficult for all of us. We all want to get back to enjoying our city with our friends, our families, and our loved ones. But as I said yesterday, we are still in the middle of an unprecedented global health emergency, and we need to stay focused on our physical distancing measures in order to win this battle. The weekend is upon us, and I know many of us want to spend time with friends and loved ones outside. But I need to remind you that it continues to be extremely important for us to stay home as much as possible to reduce the spread of this virus. I encourage you to connect, and I encourage you to stay connected with your loved ones, but to do so virtually or by phone. Your actions, these actions, will help us to get our city back, and it will help us to save lives. Thank you again for everything that you are doing to protect our city. The only way we are going to get to the other side of this pandemic is to continue to stay home, stay safe, and take care of each other. Thank you.
Thank you, Dr. Davila. Before we go to questions, just a reminder to limit your questions to 2, as there are several questioners on the line. And just so you know as well, Chief Matthew Pegg is here, should you have questions for the Chief. And on the line, we have Paul Raftis from Senior Services and Long-Term Care, and Marianne Bedard from Shelter Support and Housing. The first question is to Matt Bingley from Global News. Matt?
Hi, Dr. Davila. When it comes to the recovery effort, I understand that making sure systems are in place to detect and contain any new transmissions of COVID-19 are among one of the top recommendations. So with that being said, are you confident in the level of testing right now available for Toronto that this is something that the city can actually do?
So thanks, Matt, for the question. And just to be clear, testing is actually under provincial jurisdiction. So it's not so much a question of what the city can do. We're certainly participating and actively working with our provincial partners on testing. But I'm just going to remind everyone that testing is one method. There is case finding writ large that has to be well established so that we can readily identify new cases as they arise, identify their close contacts, and make sure that we're effectively isolating or quarantining these individuals if we are to successfully think about easing up on public health measures. So again, testing is within the provincial purview. They've made great strides towards increasing testing and testing capacity throughout the province. Clearly, we benefit from that here in Toronto, and we're engaging regularly with our provincial partners and other health system partners to make sure that everything is in place so that we can be successful as we think about recovery and rebuild.
And I know it is very early days, but when you look at whatever type of city it is when it reopens, do you look at us basically acting like it's flu season for the next foreseeable, or even the remainder of the year?
Well, I think we are still very much, as you say, in the early days of our, thinking about recovery and rebuilding our city. And I think that when we look at influenza and its patterns and how it moves through a city, it is different from what we're seeing with COVID-19. Certainly there are lessons that we can learn from influenza, but we also have learned a lot of lessons around how best to manage COVID-19 in our city from experiences from other jurisdictions and our own experiences. So there will be elements, I think, of the influenza response that you'll see. Infectious disease control principles apply to both influenza and to COVID-19, but I suspect that you will see some differences as well, and I'll look forward to speaking with you and other members of the public around what that looks like specifically as we develop those plans.
Okay, thank you. Next question goes to Francine Copin from the Toronto Star. Francine?
Well, hi, my question is for Marianne Bedard.
Okay.
I'm looking at the number of cases at Willowdale on the chart that's posted, with the city, with the public health. And the number of the cases right now is 60 in the table when we learned earlier this week that it was 110. And I'm wondering how you can explain that discrepancy.
Hi there, yes, and maybe I'll get Dr. Davila to add on to my answer. My understanding is that the public health data is updated when they've been able to verify the result. The testing that was done at Willowdale was coordinated through North York General, and the results were given directly to the agency and to the clients. And then with a partnership with public health, they go and also receive those results and verify the findings. And that's when the information gets updated.
Okay. Someone has tweeted us a question pointing out that the site for people from shelters who have tested positive for COVID-19, a 200-room site, is full, and another 400-bed site has been canceled. Is that accurate?
No, that's completely inaccurate. The 200-bed facility that we currently have active has 130 people up there currently as of this morning, so we continue to have space at that site. And we are actively engaged with our community health partners on an expanded site and working very closely with the province to ensure that that site gets opened very quickly.
Okay, thank you, Marianne. We'll go to Siobhan Morris now from News Talk 1010. Siobhan?
Hi, my questions are for the mayor. The positions you're asking Mr. Raffi and Dr. Mowat to take on, are these paid positions with a salary, or are there other costs involved at all in their work? And if so, how much are we talking?
They both have contracts, and as with other personnel matters, we normally wouldn't get into the detail of that, but they both have contracts which are, when I say short-term, they're not permanent employees. It's an assignment they've been asked to take on, and they will by and large work, as Mr. Murray I'm sure can elaborate if he wishes, they will work with public servants that we have here. We have many capable public servants here, but we needed two people steeped in experience, in Mr. Raffi's case, in very detailed sort of organizational planning, and we couldn't take away any of our very capable, for example, deputy city managers to do that because they've got their hands full, and then we needed somebody to allow Dr. Davila to continue to concentrate on managing the public health emergency as she has been doing so well, to continue to focus on that, but somebody of great stature in public health to be able to work hand in glove with Mr. Raffi to take into account the public health considerations, which are going to be paramount in deciding how we go about doing this. So I think we're just so lucky to have two people of this distinction, and with the two sets of abilities put together, I think we will have a plan working with the province and the federal government that is going to be absolutely second to none.
Can you expand on the idea of, I'm struggling to understand, and I think a lot of other people will, why these positions are necessary. You have, a very capable doctor in Dr. Eileen Davila. You have, economic development staff, other deputy city managers who you said are busy, but like, why is it that this work cannot be done within the existing structure, especially at a moment where, by your own admission, Toronto's in a tough economic spot and people are worried about the future of their jobs, worried about the future of city services?
Compared to what's at stake here, the amount of money that's going to be involved in executing this exercise is going to be tiny indeed. But as Dr. Davila said, as I've said, we've got to get this right. It's a plan that is incredibly complex, incredibly complex. If you think of restarting an economy in a city of 3 million people with all that goes with that in terms of all the businesses and the public transit and public services that might have been altered by this emergency. And the fact is, I can assure you personally, because I see them every single day, that everybody from the city manager to the medical officer of health to the deputy city managers to the police chief to the fire chief, I could go right down the list. They are fully occupied managing the biggest emergency probably this city has ever faced, the biggest economic shock and financial shock it's ever faced. So to bring in two people on a very short-term basis who have very particular sets of expertise to lead this exercise, that is the responsible thing to do. And I would do it 100 times out of 100 because that's what's necessary to get this right, and I'm determined to make sure we get this right. The people expect that. They want the best plan. They want it as soon as possible, and that's exactly what we're going to deliver for them.
City Manager, if he wants to add to that.
The only thing I can add to that is you need people who are going to be 24/7 on this task. And I can certainly say, and it was pointed out already, that the two gentlemen that we're engaging here are extremely well respected at all levels of government and well respected within this community. So I think to be able to, in relatively short notice, to secure two very senior people who have our full confidence, notwithstanding what the mayor's already pointed out, the other duties that we are assigned to make sure that the city operates as well as it can, given the circumstances. It's in our interest to have people who are not just skilled, but have relationships with upper levels of government, because I can tell you this phase that we're in is probably the most important phase, not taking anything away from the response, but how we recover, how we rebuild. And really the goal of this is to make sure that we're saving livelihoods, and to make this kind of investment with this quality of individuals, to me certainly is the responsible thing to do.
Thank you, Chris. We'll go now to Dave Ryder from the Toronto Star. Dave?
Hi. Just following on Siobhan's question, I was just hoping Dr. Davila could outline for us exactly what her responsibilities are going to be going forward versus Dr. Mowat. It's just a little, because she's been the public face of this fight, and now we're told, oh, now he's going to do this other thing. I'm hoping you can just tell us exactly what those roles are and how they're different.
Sure. So as you can well imagine, there is a significant role for Toronto Public Health in managing the next steps. Clearly, we've been very actively engaged on COVID response, but recovery and rebuild are important components, as we've just heard from Mayor Tory and Chris Murray, our city manager. And what's interesting is that, of course, recovery and response are not independent, but they are inextricably intertwined, and they must work well with each other. To say nothing of the fact that, in fact, there are other responsibilities that public health has to the people of this city. So, in fact, we have a whole other set of responsibilities and obligations we need to make sure that we discharge to the people of this good city. So, taking into consideration all three of those aspects, I will oversee and continue to provide leadership to COVID recovery and rebuild, plus COVID response, and all the other aspects that we need to make sure are being well taken care of and well managed on behalf of the city. These are all important portfolios, and you will continue to see me being actively engaged on all three of those portfolios.
Okay. And my follow-up question, I think also to Dr. Davila, unless somebody else knows, is just if there's any update on kind of the other more serious epidemic, if there's kind of two of them in Toronto, the general population and long-term care homes, if there's anything new on the long-term care home, or if we're still seeing large numbers of new deaths and new infections.
So, at a very high level, we are continuing to see cases and deaths indeed within the long-term care setting. I think as we know that a certain proportion of cases, particularly when we're talking about those that occur within long-term care, because you have an older population with chronic health conditions, we anticipate that as you see cases there, which we will see more of given increased testing efforts, that you will continue to see deaths, unfortunately, occur in those settings. I do think it's important that those testing efforts occur, and I do think it's important, and we're seeing really remarkable collaboration across the board, whether we're talking about local public health, staff within long-term care settings, the healthcare system, including acute care partners, really coming to the fore. And as we've just heard from Mayor Tory, with the provincial government and their ask and the response from the federal government, we're getting support from the military as well in 3 particular homes in this city that are run privately. So these are the kinds of activities that are happening now, important activities, in order to make sure that we do the very best we can to serve those vulnerable residents throughout our city in long-term care homes.
Okay, thank you. We'll now go to Marie-Hélène Rattel from Radio Canada.
Good afternoon, Mayor Tory. I was wondering if if the city has made a decision about the summer programs and the camps, because we've heard from some parents that they have received a refund for activities that were planned in July. So I was wondering if you could give some more information about that.
It may well be the case that some of the programs in respect of which parents received refunds stretched into July, because those were our spring programs. With respect to the summer programs, no decision has been made as yet, and it is something we discussed this morning, and we're going to, it's one of those things that will lapse into the time when the work of the recovery and reopening group will be applying some of its public health expertise, and we'll have to look at the administrative aspects of it. So no decision has been taken, but I think we're all aware of the fact that those decisions have to be taken fairly soon, simply because parents are making their plans. We have to hire and train the people that run those camps, who are primarily students and others, and so we know that time is upon us. We're looking, quite frankly, at whether there are ways, with the advice of public health, you could run those camps a bit differently with, say, more staff, because you have to, kids are kids, and to have them keep physical distancing rules in mind when they're running around in the summer having a good time is a big challenge. So those are the kinds of things that we're taking a look at. We'll have a decision on that soon.
And for my follow-up, I was wondering if you could tell us, when are you hoping to share your plan to the public about the different stages, about lifting the measures? We know that Premier Ford just said this afternoon that he's planning to present the provincial plan next week. When is it for the city?
We're working very closely with them. For example, Public Health, Toronto Public Health has a representative at the table with the province. We're talking all the time. I'm talking with the Premier. Mr. Murray's talking with his counterparts. I'm sure as Mr. Raffi gets settled in, he too will be talking with his counterparts. And we're going to be trying to make sure that what we outline in terms of our plans are not only plans that aren't radically different from that of the province, although Toronto is its own city with its own challenges, but that we try to do as many of these things as possible in some degree of tandem with them, simply so that people don't get confused, and so that we all keep up on the same sort of pace. So you'll hear more from us. Mr. Raffi and Dr. Mowat have begun their work, and they've got other people helping them in the public service, so we will let people know as soon as possible. We're certainly not trying to delay notifying people of anything. It's just a matter of getting it done properly, so that whatever we outline is communicated properly and has thought through the inevitable questions that come from yourselves and from others once you make these are important announcements and important frameworks. So we're going to get it right, and we'll have further word, I'm sure, in the days ahead.
Okay, thank you. We'll go to Mark Douglas now from 680 News. Mark?
Thank you, Brad. Mayor Tory, did Mr. Raffi and Dr. Mowat approach the city to take these roles, or did your office seek them out? And I'm wondering if there were any other candidates who were considered to lead the charge to rebuild the city.
We approached them. It was one of those instances, I think, as you've heard from the background of these two people, that as the names were put forward in discussion of different people that could take on these two very important assignments, these two people stuck out as being exceptionally well qualified. Mr. Raffi has worked in the Ontario government, which is going to be very, very important to work in coordination with them, and he knows many of the people. He's run a very sophisticated, multidisciplinary endeavor that went very successfully, the Pan Am Games, so he's known to the city as well, and he's a very experienced executive. And Dr. Mowat, you've heard from Dr. Davila, is one of the most experienced public health executives in all of Canada, and so to have those two available for us, it's an honor to be able to take them into our midst and have them provide these leadership roles. So we approached them, and thank goodness they both said yes, I think almost without much hesitation.
Follow-up question, and at the risk of repeating my colleague's question she just asked, is there a deadline for Mr. Raffi and Dr. Mowat to hand in their rebuilding plan, or is this going to be a take as long, I think you just said it was a take as long as needed situation? And also just logistically, how many staff are helping them out with this massive project?
I'll let Mr. Murray answer the second part of the question. With respect to the question of a deadline, we got to get this plan ready as soon as we can, but it's more important that we get it right, and we have to be in a position where, in terms of our accountability for all kinds of things, when Dr. Davila reaches that happy day where she's able to report to us that all of the numbers are in such a position that we can start a process of rebuilding, then it's our job to have a plan ready as of that day so that we know what's the first thing to happen, when's it going to happen, what's the second thing to happen, and all that sort of thing. So the answer is as soon as possible, and the actual implementation, though, nobody knows the date of, because that's really dependent on how well we all do to fight this virus to the ground, and then we can get on with the implementation plan. But we've got to have a plan ready for that. Do you want to talk about the staff, Chris?
Sure. In terms of the number of staff between the public health function and the function that Mr. Raffi is going to look after, we're in the order of about 30 to 40 people. And again, the bulk of those people are obviously within the City of Toronto. But let's not lose sight of the fact that we've actually been working on the recovery for actually some time. I mean, the mayor points out some good work that was done by his task force in gathering information from the community in terms of different sectors of our community, which helped us, I think, in terms of the response, but also has given us some information as to what would be useful from a recovery standpoint. As well, we've been ourselves gathering information from around the world, so countries, provinces, in fact, cities that are ahead of us in terms of recovery. So all of that information is being funneled into the office and with the staff that are very senior in position within our organization. So it's not like either gentleman is working without adequate context.
Okay, thank you. Final question to Faiza Amin from City News. Faiza?
Good afternoon, everybody. I wanted to touch a little bit on the rent relief for commercial businesses. I'm sure a lot of these business owners are happy to hear about this relief. But with the first of the month just around the corner, I'm sure there are a lot of renters here in the City of Toronto who also have the same question about whether or not they'll be seeing this same kind of relief, especially as April 1st came. We did see some issues relating to that. Have you spoken with the province, or is this a discussion that has been had with other levels of government?
For myself, we've had discussions about the residential sector, and we have, of course, both lobbied for but also responded very positively to the ban on evictions that was put in place by the provincial government early on. The notion of residential rent relief, which came predictably fairly quickly after the program was announced today for the businesses and for the small businesses in particular, is something that has been discussed only at a very top level. And I think what people wanted to see was the degree to which there could be deferral and other kinds of arrangements put in place across the board, and how big of a problem this turned out to be in the context of what percentage of people had been dislocated to the point where they couldn't pay their rent and this kind of thing. But I will just say there hasn't been an intensive discussion as there had been with respect to businesses, in part because the matter of eviction of businesses from their premises for non-payment of rent was left open. So there were, in fact, as people saw, I'm sure, through the news media, businesses that were being evicted from their premises. So the notion of doing something to backstop them became a necessity, since the provincial government decided not to ban those evictions. So I'm sure that as we go on, we're going to be discussing many more categories of people. I can assure you from the meeting of the big city mayors that took place last night by teleconference, we were discussing with federal government ministers the whole range of areas that, while they've helped in many areas, and I commend them for the strength and depth of the programs they brought forward, there are still many other areas, including municipalities, that need help, transit being another example. So all of these areas are under active discussion, knowing that it's not, there aren't the resources available to do everything for everybody, but that we are certainly discussing those kinds of priorities.
I'd like to use the follow-up to ask a question on behalf of my colleague, and she asks, for weeks, truck drivers have been voicing concerns about being unable to use washrooms while on the road doing their jobs. As this pandemic continues, is the city doing anything to help them? Are there any solutions here?
The city has put out a number of public washrooms that have been put out specifically to help people who are homeless, people who are in need of using a washroom and can't find ones they might normally have used in a public building or whatever because those buildings are closed. And in fact, we expanded the number of those washrooms just within the last week or so. And we've also, I have a couple of times up here, and I'll repeat it today, asked private sector and other concerns, restaurants and so on that have stayed open, would they please be considerate of people who need to use the washroom and might ordinarily have public facilities available to them, just to allow them to use those facilities. Because I think, again, it's back another example of this whole business of how we try to work together and support each other. And so I would hope that people will adopt a reasonable attitude in that regard. We have expanded recently the number of public toilets that have been put out there, portable toilets, and we will continue to keep an eye on it to see if we're doing a job that is adequate given the time that still has to pass before this pandemic is over with and a lot of those public buildings reopen.
Thank you, Mayor Tory. Thank you for tuning in. We'll be back here Monday at 3:45. Over the weekend, we will update case numbers on both Saturday and Sunday. Stay well, everybody. Thank you.